Welcome, everyone, to Three Essential Questions Business and Nonprofit Podcast. I am your host, Pam Myers, and I am here today with Sloan Johnson. Sloan is the CEO and pretty much head of everything at TMS New Mexico. And TMS stands for Transcranial Magnetic Stimulation. That's quite a mouthful. But it's a very important, and I wonder how. So, welcome, Sloan. First
Thank
of
you.
all, welcome. Thank you for joining. Is this so I've heard of it before, but is this kind of a new technology, or how long has this been going on?
So it's not necessarily a new technology. I think the gentleman that decided to try it on people did so back in the late 70s, early 80s. I have been involved in TMS for the last 8 years, but it's certainly been used much longer than that. It's kind of a hot technique right now because there are a lot of uses for it, and each particular use gets FDA approval. So there's a lot of announcements happening where they approve it for different uses, and that's why I think people might look at it as something that's newer.
Okay, because you can use it to treat depression, to treat addictions, ADD, ADHD, right? I was reading all that on your
That's
website.
right.
Do you want to
Those are
talk?
the things that it's mainly known for. Since it's a treatment that you're using on the brain, it can, brain, everything's downstream from brain. So it can be used to treat, a wide variety of things. But the main use and what insurance will cover it for is major depressive disorder or any kind of depression, treatment resistant or medication resistant depression.
Okay, so how does it start? And you serve primarily Santa Fe, Los Alamos.
So, and anywhere that people want to drive from, I'm
Okay.
serving. Actually, one of our goals at TMS New Mexico is to, get established in Santa Fe, and then I would like to bring it to other underserved populations in New Mexico. It's in Albuquerque and Las Cruces, and some of the bigger places, but it's certainly not found in the smaller communities where there's a lot of mental health needs. So we are actually working on a kind of, we have a tiered system here. So, we're working locally, but we also are in touch with other mental health establishments in the rest of the state.
Yeah, because if you live rurally, it can be a challenge to figure out, right?
That's right. Yeah, our hope is to bring a machine to different underserved communities. It's a little tricky because it can be a 6-week process to get treatment. So we're working on the logistics of bringing machine to an area and staying then for 6 weeks.
Got it. Okay, so it's not like one treatment will solve.
Right. No, it's we're doing a repetitive treatment that's giving a signal to the brain. To simplify it, I liken it to going to the gym. You can't go to the gym once, work out really hard, and walk out buff. You have to do a little bit over a long period of time, and that's how you gain, what we call plasticity. You probably heard that term.
Yes.
And that takes a certain number of impulses. So we stimulate over a longer period of time.
I wish it wasn't that easy, right? Go to the gym in just 1 hour.
This is relatively great. I mean, if you've had lifelong treatment-resistant depression, and and it can only take 6 weeks to change that, that's still pretty great.
That's pretty fast, right?
Yeah.
Right. And so I want to start off from the beginning. So say somebody comes to you, they call and say, I think I have a problem. Then or I have a situation that I would like to correct or address. Then what happens next?
Sure. So, we would start by talking and get a sense of what somebody's trying to fix. And that would kind of dictate treatment placement. So, well, let me even back up from there. Let me explain what TMS actually is. So, my background is in EEG. And so people would know that from, I'm sure they've seen pictures of, sometimes it's a Buddhist monk or just a person with a lot of electrodes glued on their head. And we're taking a look at electrical activity. And, there's decades and decades and decades of research showing what kind of activity we want to see in which places on your head. So in EEG, we use that diagnostically, but also for treatment. So I did something called neurofeedback for 25 years. And it's a great therapy. It's really useful and beneficial for people. But the problem with neurofeedback was always, how do we get inside the skull? Because the skull is quite thick. So we would use lights to get in through the eyes or sounds to get in through the ears. So TMS actually, well, the only way to get through the skull directly is ECT. So that's electroconvulsive shock therapy, which is not a benign treatment. It's, it requires going in to a facility, and it's not a benign treatment. So the man that invented, that first used TMS on people, realized that we can also get through the skull with a magnetic stimulation. So instead of using electricity, which is, painful because it has to be so turned up so high, we can use a Tesla coil magnet, and a magnetic field will penetrate the skull. Once it's inside, it turns back into an electrical field, but that electrical field is small enough that it doesn't require an inpatient treatment. So that is, kind of stripped down version of what TMS is. So we're just placing a magnet in different places on the head. And, coming out of neurofeedback, the placements are the same. We would treat depression over here on the left. We would treat anxiety over here on the right. OCD is generally central. So there are lots of different placements for the magnet.
Okay, depending on what your issue or what your concerns are.
That's right. So the treatment itself is a certain number of pulses, magnetic pulses. It's creating a stimulus to the brain, and that's doing a number of things. In a very simple way, what we're doing is depolarizing, and that creates action potentials. So if we think of, neurons as trees and the synapses as branches, what we're doing with this stimulation is sometimes the branches get tangled with other trees or stuck together or whatnot. This stimulus, it not only creates new branches, it can depolarize. So if branches are bound together and stuck, we can bring them apart and depolarize them. And so they now have the potential to bind with something else. So in TMS, we talk about treating a focal point or a location, a single location, but we're also really treating networks. So we're not only working a location, but that location is part of a network that's discussing things with other networks. So it's really a pretty global treatment.
Wow. So the magnet on the brain is allowing you to manipulate to a certain extent. Correct me if that's the wrong word, but to basically control connections inside the brain, and then help them.
Yep, I would say that works as a
Yeah. Wow. And what made you then start up the company? Because you started the company just in June, correct?
Sure.
Yeah. So you've been doing a lot of this work and have all this great background. Then what was your catalyst, and how did you come to start your own business?
So for about 8 years ago, I started as a consultant for TMS. So I would take an EEG reading of someone's brain to determine the best placement of the magnet. And, in that way we could look for any dysfunction and determine, hey, this is the part of the brain that needs treatment the most. During that time, I watched a lot of people get a lot better from the treatment. I was very impressed with it, and I continued to be impressed with it. I moved to Santa Fe in January of 2020, intending to start my practice.
Yeah.
The world had other plans for me.
Right.
So I'm just getting going. I moved to Dr. Jefferson Davis did TMS here in Santa Fe before he retired a couple years ago, and I've spoken with him a number of times. He's a really knowledgeable, wonderful, compassionate man, and he did provide TMS here for a number of years. But since he retired, no one was providing it. It's something that I had intended to do in any case, and so just got started this June.
Okay. Wow. Yeah, and we do have a shortage of specialists and medical professional within our
There's
state.
certainly
Yeah.
mental health services needed in the area.
Yeah. Wow. Are there things that it does not work well on?
So it's a very individual treatment. If you look at a meta-analysis, and a meta-analysis is just, rather than looking at one study, a meta-analysis is a group of studies looked at all together. If you look at a meta-analysis of TMS, it is an extremely beneficial treatment. It works in about 80% of cases. I have a Google alert set for any TMS research studies that come out. It's a really hot topic right now. So there's about 30 studies coming out a week. And they change the parameters a lot. They say, does it have to be localized? Do you have to have it in the right spot? What kind of power do you use? They change all these parameters in all the studies. But the bottom line is generally 80% of the people get better. And that 20%, like I said, it's very individual. Usually the 20% that do not get better, my belief is that they're actually getting better. There's better integrity neurologically. They just might have a dysfunction that's kind of severe, and so they don't necessarily feel it in their everyday life. Of course, that's the goal, is that somebody comes in and you increase their quality of life.
Right.
But it doesn't happen in about 20% of those cases. So, well, okay, now Pam, I forgot what question I'm answering.
No, just like, are there things, and that's totally fine. Are there things that it doesn't work well?
Oh, sure.
Yeah.
So, right. So, it's not that there isn't something that it's not a condition that it works or doesn't work for. It's more of an individual thing. An individual might come in for whatever different reasons. For some people, it will work. For some people, it may not. PTSD is a pretty tricky condition in any type of treatment. And what we've found with PTSD is that it can really help with some components of it. So it can remove the depressive component of PTSD or the anxious component of PTSD, but maybe not the traumatic ideation. It really depends on a case-by-case basis. Same with OCD. For some people, it works quite well. For others, OCD can be tricky. But the insurance model for depression, it tends to be quite effective.
Okay. And does insurance cover this for many patients?
It does in certain cases, and it's changing all the time. So I expect it to continue to get better over time. But right now, insurance is pretty generous about covering it for major depressive disorder. So if you can get a diagnosis from a psychiatrist or a therapist of F33.2, which is major depressive disorder, insurance is pretty good about covering it. We are working very diligently to get in network with insurance because it's a wonderful treatment. It's a beneficial treatment, but it's an expensive treatment. Our overhead, the equipment costs and upkeep and maintenance is quite high. And we try to keep our overhead down so that we can provide it. But if people can use insurance, that's wonderful for them. So
right.
Now off-label uses, it's hit or miss. It depends on your insurance. Insurance has not traditionally been very generous in other types of conditions, but it's fabulous for things like post-stroke. And there are lots of different kinds of TMS. So you'll hear like ITMS or RTMS or NTMS. A lot of that is useful. Some of it is just marketing, but so there's a lot of different kinds of TMS. We have some pretty great equipment, so we can do a number of different kinds. But NTMS, which is neuro-navigated TMS, can be really effective for things like post-stroke where you're not exactly sure where the damage is. You can go in and do an EEG or an MRI and locate the points of damage, and then you can tailor treatment for that.
What about some kind of addiction?
It's fabulous for addiction. There are a lot of rehab places that are adding TMS. It can be quite beneficial for addiction. Yes.
Yeah. And your average treatment is 6 weeks. Does it generally take longer than that, or can it?
Yep. So the studies mostly show that there's a certain amount of pulses that are needed. And the way that insurance has covered it is that they want you to come in every day, 5 days a week for 6 weeks. So they've determined that you get a certain number of pulses per treatment, and 36 treatments is kind of the sweet spot. So it's not the kind of thing that you would want to go do, let's try it out and do a couple and see. It really can happen over time. In fact, some people don't feel the changes until even 2 weeks after they've stopped the program. So it can really, and again, it's very individual. Some people feel it the very first time. Others might not feel it the whole time. And then, like I said, a couple of weeks later, they're all of a sudden thinking, oh my gosh. So it varies by person. Now, because they've determined there's a certain number of pulses that you need, they also have looked at how close together can we put all those pulses. There is something called accelerated TMS. There's the SAINT program. The SAINT program is something they're doing at Stanford. And it's an accelerated form of TMS. So they'll do 10 treatments a day for 5 days. You get the same amount of pulses as you would over 6 weeks. My feeling about that is that, again, it's very individual. For some people, that's great. The studies are showing that people get the same benefit. However, I don't think that they're finding that they last quite as long. So again, if you liken it to going to the gym, if you go work out 10 times a day for 5 days,
right.
Versus doing it every day for 6 weeks, you're probably going to see a little bit better. Now, it can work for some people, and I think there's a sweet spot there. I'm finding that I like to do maybe 2 or 3 treatments a day for people. That way they can get it over with faster, but they're still doing it slowly enough so that the brain feels it over time. We talk about with behavioral things that you want to, if you want to do a New Year's resolution or change a habit, we talk about 40 days is the sweet spot. If you change something for 40 days, there's a better chance that you'll stick with it. And it's kind of the same here. I think you can throw that huge number of pulses in one clump, but really, I think it's more beneficial to do it over a slightly longer period of time.
Yeah.
The studies come back. There are a lot of studies showing both cases there. So again, it's a little individual.
Yeah. I mean, that would it makes sense that you'd want to do certain doses specifically tapered out, I would think, just like you do so many other treatments. You're not going to do it all in one day. Now that
Yeah,
I'm looking at a picture on your website, this woman is reclining or she's relaxing in a chair, just like you go to the dentist. Um,
right.
is it
Yes, it's
what?
like a dental chair.
Oh, what is the length of time per treatment? Is it 10 minutes or an hour, or how long does it
Sure.
take when somebody is in the chair?
Sure. So my preferred form of treatment for people, and again, it varies by individual, and we discuss their needs before we start, and then we make a protocol. But my preferred general protocol is to start with a treatment for anxiety and then treat the depression. I
Mm,
rarely see depression without other components, things like anhedonia, which is the inability to feel pleasure, um,
mhm,
or an anxious depression. So my favorite treatment for people is that we would start on the right side. We would do a lower frequency. So there are
mhm.
different frequencies that we can use as a carrier wave. The lower frequencies are going to be more inhibitory, and the higher frequencies are going to be more excitatory. So I use a 1 hertz inhibitory treatment on the right for anxiety, and that takes 9 minutes. And then we
Mm,
would
mhm.
flip over the magnet and put it on the left. We would I like to use a gamma frequency, so we'll use 50 hertz or higher on the right, and that's somewhat excitatory. But once you get into 50 hertz and up, and you're in the gamma range, we talk about brain frequencies behaviorally. So we talk about, sleep is delta wave at 0 to 4.
Mm.
Then we have theta, which is a dream state. Then we have alpha, which is relaxed awareness. And then we have beta, which is problem solving. And then gamma. Once we get into the gamma range, we're no longer talking about behavioral frequencies. We're talking about the structural integrity of the brain itself. And so I really love gamma for that reason. When I first got into the field, 25 years ago, we didn't quite know what to do with gamma. We didn't do a lot with it. But over the years, realizing that it's a structural frequency, it's starting to be used in some really fascinating ways. So, for example, there are some pretty cool studies about gamma frequency reducing the tau proteins in there's one study in particular I'm thinking of where they reduced the tau protein in mice by 50%. Now, tau protein is what we talk about as amyloid plaque. So if you're talking about Parkinson's or Alzheimer's, all of the neurodegenerative issues, then this is that result of reducing it by 50% is really phenomenal. So
Huge, yeah.
yeah, and there are ways to do gamma training. You can buy a $500 machine where you just put ear clips on that's giving you gamma frequency, and you can walk around with a little stimulation on your ears and reduce your tau protein. So it's pretty
Wow.
phenomenal. So that's why when I treat depression, a lot of places historically have treated depression using alpha, which is pretty standard. That's where we want to see people operating during the day. But I like to go that step further and treat with a gamma frequency so that we're really increasing the structural integrity and
Okay.
hopefully shaving some years of abuse off of people's brains. So it's all, I
Yeah.
mean, it's pretty fascinating stuff. It's very interesting.
It sounds fascinating. Um, so are they is the individual fully awake? Just
Oh yes.
yeah,
So
fully awake
here's
and you know
here's
everything?
the experience.
Yeah.
People come in, the first. We generally talk to people on the phone so that they can make a decision about whether or not they want to come in, because so we'll get a sense of, is this right for you or whatnot. When
Mhm.
people come in, the very first session is we put a cotton cap on their head, and then we do a bunch of measurements, and we figure out where these places are that we want to address and write it on their cap. And then we figure out what power everybody's brain is going to want a slightly different amount of power. So we figure that out. So the first session is maybe an hour and a half, depending on how much people want to talk. Once we get them set up, they just kind of write it in their schedule. They show up, they run into the office, they're in and out in 20 minutes. So,
wow.
Yeah. So when people are, at first I thought, oh my gosh, people have to come in every day for 6 weeks. How is this going to work? And it's been pretty great. They get used to coming. They enjoy it. They run in, they sit in the chair. We pop the cap on, we place the magnet. The treatment itself is pretty benign. Depending on the power of the signal, it feels like someone's tapping on your head.
Okay.
Occasionally people find that, kind of uncomfortable, but really it's very benign. Most people are in it. And like I said, they're in and out in 20 minutes. It's a pretty easy procedure.
Yeah. Not invasive. Doesn't sound.
No.
Wow. Very, very informative. Thank you so much, Sloan.
Sure.
Is there anything that you want to add that we have not touched upon? I mean, really, you've been so thorough in everything.
Oh, sure. Well, so like I said, because you're treating the brain, there's really many applications for it. I guess things I would want to add. For my long history in the kind of neurological aspect of healthcare, over the years, I've really always thought there's too much of a separation between physiological and mental health. We look at these two professions. One is physical health and one is mental health. And really, mental health is physical health. So if you have a proclivity towards diabetes or heart disease, you have a much greater chance of getting a mental, and I'm doing air quotes for anyone not watching, mental diagnosis. Mental health really is about cellular and mitochondrial integrity. And there are books coming out finally about that. There's one called, I think it's called Brain Energy. I want to say his name is Parker. Oh, sorry, I read it last summer. Okay. It's a fabulous book, mostly because it's written by a psychiatrist. So what we would think of as the quote mental part of the field, but he's writing about, the rise in mental health issues in our society is really indicative of the decline of our physical health. So you really can't separate. And for some people, this is great to hear. I have people call me who say, like, I'm not okay. And, they feel like it's a failure on their part, like their personality is there. It's like, they're failing at having a good personality, and this is some kind of defect. And really, a lot of the times it's just the failure of the body to be able to support the brain. The brain is a big fat hog. It needs fat and energy. And if you don't have the mitochondrial energy to run your body, you're not going to be able to run your brain. So my practice, part of me is very relieved to do one thing. I'm just doing TMS, but my background is in whole systems medicine, functional medicine. They're very ambitious. They treat all of this stuff. And so it's really hard for me to shed that. So everyone that walks in, I like to add, a lot of recommendations. So I always tell people, you're only here for TMS and nothing else is required, but I have to make a number of suggestions because really it's generally people don't feel well if they have an inability to support their brain function.
Right. I mean, I would think that would be a great benefit, a great asset, because it enables you to look at the whole big picture. Nothing is always just one thing, right? It's not that simple.
Nothing is ever one thing. And I always tell that to my patients that you really don't want just one good practitioner. You want an arsenal of people, and you want to listen to as many recommendations as you can and then make your decisions from there. So,
yeah. Well, thank you. Thank you so much for being a guest. Now, if people would like to make an appointment or check out what you can offer, it's TMS msnewmexico.com. It's very easy to find. The website is very informative. There's a blog link on there and an appointment booking link on there, which is very convenient. So
Yeah, and we're
thank you,
happy to
Sloan.
answer any questions. If you want to email info@tms.com, we will answer your questions. And
Yeah. Thank you so much for being a guest on the podcast. We really appreciate it.
well, thank you so much for having me.
Yeah. Thank you, everyone, for listening. We are here to elevate the voices of New Mexico business owners and nonprofits, and we hope you keep listening to these podcasts. Thanks so much.